All right,
Okay.
Bobby. So what was your condition upon entering our clinic, and how long had it existed for?
I had some neck issues where I couldn't turn my head to the left, especially when driving is when it was the biggest problem. And I'd gone to a chiropractor in Commerce Cove a couple times, and he just like cracked it and said, "Here, take these pills," and it didn't really do much of anything. With Dr. Schels doing the exams, we found out that I have scoliosis in my neck from a previous neck injury I got in my 20s, and my right shoulder was taller than my left shoulder, which my husband knew, but had the good sense never to say anything because it kind of made me upset. Because then he started like, "Ooh, Quasimodo." And so my husband was a teaser. Anyway, Dr. Schels started doing his cracking and adjustments and everything else, and I very seldom have neck pain now. If I do, it's because I'm either staring too long up at the sky, looking at the stars, or I'm leaning over too far, doing something to irritate that area. But I can drive without any pain now. I can have more freedom to turn my neck to the I couldn't do that before, and now I can.
Ooh, look at you, girl.
I know, he's
That
got the
range of
magic touch.
he does. He does.
And my I'm not quite so crooked anymore.
Oh, I love that.
No more Quasimodo.
So I think you answered a lot of these questions. So what daily activities or hobbies did your condition interfere with? So it sounded like quite a bit.
Yeah, it did. I mean, obviously driving. I used to be a secretary, so that was lots of looking down, and so I'd get lots of headaches and that kind of thing from work. And I'm a quilter, so sewing a lot would
Upset that as well.
would irritate it. Yeah, it did. And same, it also affected the shoulders, and I didn't all connected together.
That's true. That's true. And besides the other chiropractor, did you see any other doctors for this condition?
No.
Okay. And how or who referred you to chiropractic?
We went to one of the home shows at the Expo Center.
Yes.
And y'all were offering one of your little, hey, let's check you out real quick. And my husband had neck pain really bad for a very long time because of the military. And he decided, all right, let me see. And so Dr. Schels was the doctor who wound up checking us out. And my husband really, really liked him. So we came back and we went and got the whole workup and everything else. And he really helped my husband. I no longer heard 50 times a day how much his neck hurt. And that man was constantly talking about how bad his neck was always hurting. And Tylenol didn't help. The VA and all that, they weren't able. It was like pills and, well, you've got this, or you've got, degenerate bone disease. What do you expect? Dr. Schels fixed his neck, fixed it really good. And my husband wanted to keep coming, and we live in Kepner, so this is
a drive
this
for
is
you
quite
guys.
a drive. But he did not want anyone else. He really, really liked Dr. Schels, and y'all, it's like family here. It's really great.
I was like, believe me, we think of you guys as family as well. We love it. And then can you describe in great detail what chiropractic has done for you?
Okay, well, I mean, with my neck not hurting, then I don't get so irritated, and it does help me sleep a bit better. I don't have lower back pain between Dr. Schels doing the adjustments and some of the stuff that he has, the little weight vibrating little thing.
No, the Live Vibe. Yes,
Thank you, the Live Vibe. My favorite is the bed you lay on with the roller coaster.
The intersegmental traction.
Yes. Oh, I love that. I want to take one of those home with me.
I've been trying for years.
But it does. I feel better. I can tell. Like when I go on my quilting retreats, sometimes I'll have to call y'all and say I need to come in a little bit earlier because I can feel the tension from sitting there and just doing the nonstop, the sewing and everything. I can feel it up in the shoulders and the neck area. And he does his magic voodoo, and I go home happy.
So it sounds like it's just giving you a better quality of life.
Yeah, it
overall.
has.
That's awesome.
And when my husband was around, I didn't have to listen to him complain about neck pain anymore, and that was a big plus. He helped a lot with that.
Well, I mean, I'm pretty sure it put him in a better mood not being in pain as well. So
Definitely.
that
Yes.
always helps.
Definitely. Yeah, you don't think about that, but that's true. When you don't hurt, you just get to be a wicked person all around.
Yes, yes. I mean, and everybody gets that way.
Yes, that's true.
And then what would you tell someone with the same condition about chiropractic care?
I tell them that it's definitely worth a trip to go to the doctor, to have them check it out and see exactly what's wrong with you. And be sure to see someone who's going to do x-rays to start with. The first one I did not do any of that. And Dr. Schels has done, as we progressed along with him, he's done updates to see and showed us before, this is when you first walked in, this is what was going on. Now this is what's going on after so many months later. So we can see that there's actually improvement going on.
Absolutely.
You know, and of course, you know, it's yours because it's an x-ray and you can't fake the name and all that jazz. So I mean, there's no medicine involved in it. There's no take this pill and you'll get better type stuff. There's exercises at home that he suggests we do. He suggested that we sleep with them better pillow, kind of like orthopedic type pillow, I guess, for lack of a better word.
Yes.
And to help with the neck pain. And my husband loved his so much. When he was in the hospital, I took it to him in the hospital to help with his sleep there because he was in so much pain with everything going on with him, just to see if it would help any. And I mean, if you follow what he says, just like any other doctor, you follow the directions the doctor gives you, you're going to start feeling better. You know, and it's not hard. I mean, just a few minutes a day to do a couple of exercises. I mean, it's not that big of a deal.
It's not whenever it's for the long haul and it's a big life change. Not
Yes,
being in pain
definitely.
every day. Absolutely.
Definitely.
It's worth the investment and worth the time.
Mm-hmm.
Yes. Well, thank you so much, Bobby.
You're welcome.